Welcome to State of Reform's virtual series, 5 Slides We're Discussing, with some of healthcare's most thoughtful leaders. And now, the host of State of Reform, DJ Wilson.
Welcome to another edition of our 5 Slides We're Discussing virtual conversation series here at State of Reform. Really excited to have you with us. For folks who are online watching this after the fact, after it's been taped, and also the 300 of you who are signed up to be with us today. This series is sort of born with the idea that nobody really is excited about getting back into a large conference room at a hotel or convention center with 400 or 500 of your closest friends in healthcare. But nevertheless, the issues that we're facing to reform and move our healthcare system forward continue to remain. They're even a little more acute in this time of COVID and this pandemic. So we're excited and honored to host this conversation with two of Texas's really more thoughtful health care and behavioral health leaders in the state. Sonja Gaines is the Deputy Executive Commissioner for IDD and Behavioral Health Services at HHSC, and Bonnie Cook, the Chief Executive of Mental Health America, the Greater Dallas Chapter. Thank you both for joining us today. I'll just note before we jump in on all this stuff that Del Bronsdorf was hoping to make it, but had to back out at the last minute because of a personal matter. So we wish her all the best. That said, Sonja, thank you for joining us. Before we get into our slides, let me just ask you, how are you holding up as a person? How are you holding up professionally during this kind of challenging time?
Thank you, David, for inviting me. And I think just like with everyone else, this is all very different than what we have been accustomed to. Working from home, it's kind of like we brought work into our home, and that certainly has changed things. The social distancing is probably the most challenging thing for me because I really enjoy connecting with people. But I'm very grateful, given the circumstances, that at HHSC, we've been able to actually work from home. And so that's been a positive. And using technology such as this has been very, very helpful in terms of still being able to engage with people.
Yeah, it's a luxury and also a necessity to be able to work from home, it feels like these days. And I'm not sure that we're going to be back into busy cubicles and office parks anytime soon. How about from where you sit, Bonnie, personally, how are you kind of navigating this time of COVID when we're all both stuck at home and mindful of our family's health and concerned about what's going on outside of our four walls? How are you thinking about this time personally?
Well, I think it depends on the day that you ask me. There are good days and there are bad days. I think it, like I said, all depends too. I do suffer with mental illness, depression particularly, and you really have to take those steps to reach out to individuals and be proactive. And that's not something that's always been real easy for me. So from a COVID perspective, it's causing me to have to rethink my personal habits on how you deal with any sort of depressive episode you might have. But my family's safe and secure, so I'm blessed for that. And besides that, we're all doing really well here in Dallas.
Yeah. Well, I think this is a time where we all have to meet each other with a little more love and a little more grace than maybe we thought we needed to 6 months ago or a year ago. So I appreciate you both joining us for this conversation. I want to jump onto our first slide. We had a series of slides that you all bring, and we offer a couple of them. This is one that I have contributed. Our team here at State Reform has contributed to the mix. And this is a screen grab from a recent study from the Meadows Mental Health Policy Institute, which creates a framework for thinking about unemployment increases and the impact on health, in this case, specifically drug overdose related deaths in Texas, with about a not quite 100 more drug overdose related deaths for every 1% uptick in unemployment. We were going to talk a lot about behavioral health in the healthcare system. Sonja, I just am wondering, we have these sort of competing pandemics or competing crises of our economic recession and behavioral health. How are you thinking about trying to find early indicators of how the economic recession is impacting behavioral health? When I say early, before people run into drug overdose related deaths.
Yeah, thank you for that question, David. We know from our experience with hurricanes like Hurricane Harvey that those type of events can actually exacerbate mental health conditions. And so we're very grateful that we have our local mental health authorities that are located throughout every county in Texas, and they do a tremendous job of being available to Texans through our crisis call centers. Each one of them have a call center that are available 24 hours a day, 7 days a week, where individuals can get a hold of a live individual if they are personally experiencing challenges that they need to engage. The other thing is, I'm going to talk some more in detail about this, but we have crisis counseling programs that are funded federally, and those programs are also located throughout all 254 counties. They do a lot in terms of educating and engaging various communities. So, and then there's a cadre of just our normal service delivery type services that are available, some of which include a outreach component, particularly when it comes to the homeless population. We do a lot of work with law enforcement as well, and others that actually come in first contact with individuals. So I think there's a number of different ways that we have an opportunity to touch people and to be available to them when they need it the most.
Yeah. Bonnie, how about from where you sit, how are you seeing the economy impacting behavioral health in the greater Dallas area? Is that something that you're seeing a direct connection with, or are we still too early to make that connection?
No, I think we're seeing a direct connection. When you see the slides that we're going to go over next, especially with alcohol and drug addiction, we've seen unprecedented increase in the use of alcohol and drugs to manage unemployment and to manage this stressful situation. If we go back to our college days and we think about Abraham Maslow's hierarchy of needs, and we think about that basic need for safety, that basic need for food and security, all of this doesn't live in a vacuum. We don't have just our unemployment's one thing, our family and friends are one thing, our health is one thing. They're all so interconnected. And these statistics and this information we share, we all, realize there's a person that's behind all these numbers. And we're going to have to, in this time that we really don't know how to deal with these, we're going to have to turn around and start thinking outside the box and start thinking of other ways that we can provide the support. I have can spout my platitudes about being mentally healthy, but when you don't have a job, it's really hard to be mentally healthy when you're worried where your next meal is going to come from. Yeah. So it's a complicated issue, and one that I'm happy to know that everyone that's on this call is concerned about it, and that we're all trying to find the best solutions for the best time for the best day.
Yeah, it's hard to get ourselves, hard to get the totality of the challenge we all face collectively, hard to get our hands around that enormity. But certainly we're trying to keep the conversation going, keep some social connections going, even in a time when many folks are not being outwardly social otherwise. Let's move to our next slide. This is one that you've brought to the conversation, Sonja, and there's quite a bit of detail here about HHSC and the work that you all are doing there. Why don't you walk us through this slide and tell us what you got going on?
Absolutely. I'm very grateful that Texas had already had a pretty good, strong infrastructure in terms of responding to crisis and disasters. And during COVID-19, we were able to tap in to some of that infrastructure that really helped us to get some services on the ground pretty quickly. The first thing I want to highlight is our COVID-19 mental health support line. This is a support line that is available 24 hours a day, 7 days a week, and it's actually manned by mental health professionals. And the line is available in different languages that people can call. So if individuals are dealing with stress or depression or just have questions regarding how to cope during COVID-19, they can call this number day or night, weekends and holidays. The number is 833-986-1919. I can tell you thus far, we've gotten a little over 5,000 calls that have come in. And we're getting calls from just about everyone that you can imagine. We have mothers that are calling and fathers. We have people that are dealing with their unemployment and, what do they do next? We have people that call in and ask about testing. Where can I go to get testing, done? We even have frontline workers that are calling. And, I'm most pleased that we're also able to offer those frontline workers some extra support as well. So in addition to the call line or the support line, we also are offering a virtual support group for frontline workers when they call in. And so we've had several people that have taken advantage of that. I think we have to recognize the pressures and the stressors that frontline workers are dealing with as well. And just to give you a little bit in terms of the statistics of what we're seeing, about 55% of the people calling are calling to get emotional support and just trying to figure out ways of coping. 21%, the main reason that they're calling is looking for testing or medical information. And then about 12%, the reason they're calling is for mental health support. This line is also capable of referring individuals to the appropriate resources so people can get ongoing help and support. We have our local mental health authorities if people are eligible for those services, as well as community-based mental health services if individuals have insurance. I also wanted to mention that about, we have about 35% of the callers are between the ages of 18 and 39. 32% of the callers are between the ages of 40 and 64. And then about 11% are 65 or older. So that line has been a tremendous support in Texas. We're really grateful we've been able to partner with the Harris Center in Houston to be able to tap into their infrastructure in order to bring that resource up. The other resource that I wanted to briefly highlight is one that we call crisis counseling services. And this is a resource that we've been able to receive close to $6 million from the federal government through FEMA in order to put these services in every one of our 254 counties throughout Texas. These services are, we actually work with survivors of COVID-19. We look at individuals' current situations and what type of reactions they're having. Some of our goal is to help to reduce stress along with providing emotional support. Many of the types of services that are being provided include training, referral, and information, and education. And these services are also provided through our local mental health authorities as well. So I just want to say that, we in Texas, I believe, have done a tremendous job of having some on-the-ground support that has a presence in every single county throughout Texas, along with having a live support line that people can call 24 hours a day, 7 days a week to get a live individual that can help them with any of the stressors and, challenges that they're experiencing with COVID-19.
Yeah, very good. Before I move to what looks like our first question from one of our attendees, I want to just call out and say thank you to Pfizer, whose generous support has allowed us to continue to provide these virtual conversations in Texas for free. They have come to us and said, we want to continue to foster constructive conversations in Texas about health policy, particularly about mental health policy. And so we're really honored that they have been supportive of this series. I want to ask a question from a participant who wants to know, and Sonja, I'll ask you to sort of speak to this since it comes in response to your slide, about a recent poll that came out that shows a majority of Texans are interested in a healthcare system that incorporates the social determinants of health. And Michael Goldberg is wondering if you think there will be more legislative discussion, more policymakers discussing incorporating those social determinants as we think about healthcare, either in the next legislative session or as HHSC continues to move forward. What are your thoughts on that?
So, I would dare say that COVID-19 has caused us to think about a lot of things that maybe that would be helpful in terms of us putting more emphasis on. So, I would hope that would be of interest. Of course, I work at the pleasure of the legislature, and I stand ready to help and support. But I think we're spot on when we talk about the social determinants of health. We know, like, even through this situation, people have been impacted in terms of their the money that they have coming into their household, or having stable housing, having a stable job. We recognize that all of those things play a huge role in terms of mental stability, and they're all very important. You can't not focus on those things and expect that everything is going to be okay. So my hope is that we do have more focus in that area as well.
So Bonnie, let me ask you to respond to that question too before we move on to your slide. Do you have a sense in the Dallas area and among policymakers and other key stakeholders that you work with about how social determinants are sort of becoming manifest in these broader healthcare conversations?
Well, for us in Dallas, the south part of Dallas is still limited in the services that are provided. So we're finding out that COVID has brought that into an even starker light. And we are finally having city officials and legislators wanting to start talking about what we do to have a more equal response to mental health and a more equal response to how we deal with adverse childhood experiences, how we deal with these social determinants of health. And as I said when we started off, we've siloed everything for so long. We've got our mental health, we've got our physical health, then even for our fundings, they're siloed based on what committee it has to go through. And so I think in this age, it's going to take us turning around and looking at possible solutions to these problems, but not just from one lens. And we need to look at several different lenses and bring people to the table we've never brought to the table before to start trying to address those.
Let me ask, we're going to jump to our next slide here, the one that you brought to the conversation here, Bonnie. I think there's a lot going on here. Why don't you walk us through what we have here on the screen?
There's a lot going on in this slide. Mental Health America of Greater Dallas provides free online screenings to anyone. You can go to our website at www.mhadallas.org. So you can go right now while you're sitting watching this and go take a screening. These screenings are all evidence-based. And each of these screenings provide voluntary demographic data. We don't track names, but we do track gender, we do track income. And so you can take a quick screening and find out where you are with your mental health. We've been doing these screenings for 4 years now. And in January of this year, our screenings run usually average. But what you can see, we did over 8,000 screens that were taken in May. For those 8,000 screens, we were up 185% from April and 521% from January. Now, this data is Texas specific. My Dallas statistics show this data exactly the same as an increase. If you'll look quickly at the substance abuse one, it has skyrocketed. If you look from January to April, we have had a 629% increase in the number of individuals that are testing positive for substance abuse or alcohol addiction. And similar to our depression screenings, again, a 495% increase. What happens with this data is we get the results every month. So every month that data is downloaded. So, and a lot of times when you talk about, oh, we're seeing an increase in depression, we're seeing an increase in this, we see an increase, but we can't look at that data specific. Since we have these numbers so quickly, this is the most recent data for May. So by the end of July, I'll have June statistics to give out. So this is a unique program that we do at MHA that you can turn around and look at these. If you look at the anxiety screenings, you'll also see that huge jump in the total screenings, and then the results from moderately to severe anxiety. And the good news about taking these screens is that we can then turn around and look at these numbers and have programming specific to address those. The moment we realized how valuable and how helpful this screening data is in Dallas. In November, we got the screening and PTSD was off the charts. Well, all it took was for October, when we had the tornadoes that went through, it was obvious the stress that people were feeling based on those tornadoes. So when we started seeing the anxiety and the depression, and we saw the age range. So our screenings back when we had the tornado, the majority of the people that were suffering with PTSD were under the age of 25. So that made us take it one step further and think about probably the anxiety that kids were facing. So we turned around and we made mental health tote bags and kits for kids that were displaced by the school district and how to be mentally healthy. So we're trying to take this data and talk about it before stage 4 philosophy. We don't treat cancer, diabetes, and heart disease. We don't wait till stage 4 to deal with these. We're waiting to stage 4 to deal with mental health crisis. And so with this data and with us knowing that COVID-19, this data is going to turn around and help us try to figure out, okay, we see a problem coming. We already see that this data is going to put a stress on Texas. So how do we turn around, take this data, and then turn that into meaningful reform and meaningful ways to help people so that they don't die by suicide and they get the assistance they need. So that's what we're hoping this data will do. And we're hoping this data will then turn around and legislators can use it in the upcoming session for us to come up with viable solutions to our issues.
Yeah, thanks, Bonnie. There's a lot there. I appreciate you sharing that. There's a question from Venus Gaines, sorry, Venus, as I mess up your name there. She is talking to the role of promotores and community health workers and their effort to connect in a culturally competent way across racial and ethnic health disparities in public health. She said her organization launched a telehealth community navigation program in 5 major Texas cities, engaging with promotores and community health workers with hotlines so they can get a reality check on mental health issues among the Latino and Hispanic population. She said after over 12,000 phone calls, over 80% of the Latino population still does not trust the government. Some of that may be deeply cultural. Some of that may be more specific to particular policies, maybe at the federal space in particular. Either of you, Bonnie, Sonja, thoughts on how to bridge the trust gap that can exist, particularly in non-white communities at a time when mental health is deteriorating?
I really think that, again, we're going to have to bring other people to the table. As a white woman, I don't want to be the one that leads the charge. So at MHA of Greater Dallas, we have started reaching out to the Hispanic community. In the last 2 months, we now make our screenings available in Spanish. And I think we need to make sure that our Hispanic community has a voice to trusted individuals, and that we can be allies and help them get their message out.
Sonja, any thoughts on this trust gap?
So, as someone that actually provided services early on in my career, I do recognize the importance of what we're talking about here. And, it's important that we have service providers that represent the population that we serve, as well as our ability to embrace those different populations. Sometimes not in a traditional way, maybe connecting, with them in the churches, in the schools, making sure that our services are diverse enough in terms of, different languages that for interpretation. I'm really pleased that through all of our local mental health authorities and our substance use providers, they have the ability to have interpretation services that are available. The other thing is not just expecting people to come to the office, the ability to do some outreach and go to where people are. Sometimes people don't just naturally engage because of the stigma, associated with mental illness, for example, or even substance use. And so I think that, reaching out to people is important. And the last thing I'll mention is the use of peers, people that have a lived experience, irregardless to what background and race that they have. I think prematorias fall into this category where you have someone that either has had a mental illness or a substance use challenge in their past, and they're able to work with other people that are now having those challenges. We have found that peers have an impact that is beyond what we see just from a clinical approach. So I think all of those approaches really can help and add value.
Ken, Janda, or Yanda, I always forget how to pronounce your name, Ken, who's run community health plans and been involved in the Texas Association of Health Plans, asks a question about the high rate of uninsured before COVID in Texas, and the question of Medicaid expansion and how that would help adults. I'm wondering, Bonnie, what do you think? Where do you think that the sort of central policy question of Medicaid expansion that Ken brings up, where does that fit in the policy conversation for the legislature moving forward? And I'll ask that, like I say, to you, Bonnie. I know Sonja has different restrictions, but I'm wondering what your thoughts are.
Sure. Since February, 660,000 people have lost their health insurance. So we were already last in the country with access to insurance. So now that when we add this 660,000% increase, 29% of the people in Texas are uninsured. Medicaid expansion is a solution. It is a viable solution to make sure that individuals have insurance coverage. When we go back to our initial conversation, and we're talking about suicide rates and deaths from drug addiction and alcohol abuse. If we can turn around and these people are unemployed, but we can figure out a way to make sure that they keep their health insurance, I think we're going to go a long way in alleviating some of Texas's issues. And you can look at other states, and other states have in the long run saved money when you do Medicaid expansion. So Mental Health America and Mental Health America Greater Dallas, we are all for Medicaid expansion. And I do think it's something we should seriously consider in this legislative session.
Sonja, let me ask you about the feeling at HHSC. And what I mean by that is We've got this looming budget challenge for the next legislative session with the fall collapse in the price of oil and, of course, the economic struggles and recession. So we've got budget constraints. There's hope that we'll have additional federal dollars flow to the states. We also have this sort of 1115 waiver that's going to continue to march forward, and DSRIP funding will diminish in relatively close short order here in that 1115 waiver. Do you feel like this is a time at HHSC where you all can play offense and really move the ball forward in meaningful ways because of some of the potential for federal dollars? Or is this a time where you're playing defense and you're going to have to respond to budget cuts in the future, and so you're really targeting the highest priorities and the highest ROI right now? Give us a sense of that feeling.
So, David, I think we all recognize these are challenging times right now in terms of funding that might be available. I'm going to say that from an HHSC standpoint, and even from a state government standpoint, because, I work with HHSC, but I also work with 23 state agencies that receive behavioral health funding. And one of the things that I've come to realize is just as important as the money that we have and that we want to keep, it's also important that we are maximizing the resources that are available across all of those areas, that we're not duplicating services, that we are, really partnering with each other when that opportunity presents itself. And I would say that through those 23 state agencies, at least from a behavioral health standpoint, we've come a long way in the past, 5 years as a result of the statewide behavioral health strategic plan that was developed. And we were able to identify major gaps in our system that we've actually been able to address in a different way that we've ever addressed before. I would contend that every problem doesn't necessarily need money. Sometimes it needs a will and a momentum to move in a positive direction. So I would say that some of that progress that we have made has actually positioned us in a much better place. Yes, we still have some challenges with, thinking about the 1115 and what might happen with that. Those are things that we are still working on with the feds. But I'm most proud of the work that we continue to do and look at maximizing, again, the resources that we already have.
Yeah. Emily Berger asked a question about policy conversations in general that may come up in the next legislative session. I know we're a long ways away from that, and we just got through our runoff election last night, and we've got general election in between now and then. But give us a sense, Sonja, of where you think, to use a sports metaphor again, the puck will be going this time in 6 months. Meaning, what are the shape of the conversations that you think we might be having in the mental health space on the policy side 6 months from now? Any sense of that?
Oh, that's kind of hard to answer right now, but I will say, COVID has will definitely have a presence there in terms of what type of impact this has had, on Texans in terms of the need for resources and supports, on an ongoing basis. I think we all recognize that we're still in the infancy stages of the pandemic. We're still doing a lot of social distancing. There's still a lot of people that are at home, staying at home. And as time goes on and we start to progress and, we're looking at children, getting ready to go back to school, all of those things will have an impact long term. So I don't know what the presence will look like, but I'm sure there is some interest in terms of, looking globally at what do we need to do, to have the proper resources available to meet the continued need, for Texans in response to the pandemic.
I want to jump to our next slide. And this is one that, again, our team at State Reform has brought to the conversation. As many of you know, we cover health policy and healthcare in Texas, but we also do that in 8 other states. One of the states we cover is Washington State. And this slide comes from the Department of Health there in Washington State. I just think it's a really unique public document that when we see things that are interesting in one market, we want to share those in others, and this is one of those. This was produced by the Department of Health in Washington State that pulls from data and studies on other pandemics, including the 4 flu pandemics of the last 100 years, and other earthquake and other natural disaster impacts, things like Harvey in the Harris County area, and charts a pathway for mental health that is not terribly positive or hopeful. In fact, rather, it shows a significant fall off after a period of some honeymoon effect. And people go through this in different ways. And of course, people may have different opinions about this slide, but this slide would suggest, at least according to those public health folks in that state, that we've got, it's going to get darker before the dawn, so to speak. Bonnie, I want to ask you, does this slide resonate with you, or do you take any particular lessons or thoughts from seeing this slide?
I think when I look at this June 15th, 2020, where, we can kind of say I don't think it's going to be a straight down projection. I think our projection is going to go in a wave. Just like I said, we've started off the top of the hour that, it's a day by day situation and everything changes so quickly. And I think this trajectory may be longer for the disillusionment period. We all thought we'd be done this by, summer, August, we'd still have football, we'd still, and life would continue. So this slide is for a one-time, probably, a disaster. There was a rebuilding phase, there's this, and there's actual steps that you take. With mental health and we all want to be able to hang on to something. And there's really not a lot that we can hang on to because our emotions are so up and so down, and we're all still trying to navigate what that might be. So it is a discouraging slide, but I do think that if we turn around when we are in this downward slide and we start thinking about solutions, when we start thinking about kids going back to school, and we start thinking about the anxiety and the stress that we might be facing, when people are trying to go back to work, if we start thinking about that mental health of individuals going back to work, we're really talking about making sure that we're staying 6 feet apart, that we've all got hand sanitizer, that we've all got masks. And at MHA, we're trying to focus on making sure that your mental health is taken care of. So we've got a toolkit for returning to work that's on our website. We've also got a program for school kids, a We Help Ourselves program. So if we start when we're at this trajectory of going down, and we start thinking about it a little more upstream and thinking, okay, we've already seen the statistics. We're already seeing the reactions to people. We're getting, 5,000 calls of people wanting to do our helpline. And so that we all turn around and start thinking, okay, we already see that this is a huge problem. So let's start thinking now. Let's start looking at this disillusionment phase. And we turn around and we start saying, okay, what can we do right now? And when you're in therapy or you go see somebody, one of the first things they say after you've rattled off everything you need to say, they say, what can you do right now? And so if we start from that point of what we can do right now, then for me, this slide isn't as demoralizing as it looks if we think about it from a reform perspective and we think about what we can all do on this call to get us to the next stage.
Sonja, how about you? When you see this slide or you think about the data that you come across in your day-to-day job, is it this bleak? What do you think?
So David, I will say the first thing I think about when I see this slide is the importance of the availability of services. And what we know is that when people have immediate access to service, they're less likely to decompensate. And so one of the things that I will say is that in Texas, we've been very, very fortunate that our legislature has really embraced and actually put dollars into a strong infrastructure, that I believe from a crisis standpoint and just from an everyday standpoint that's really going to help us. I mentioned earlier, all of our local mental health authorities that have been available, and they've been available throughout this pandemic. And I really, if any of them are on this call, I want to take a moment to thank, those folks, along with our substance use providers, for the incredible work that they have done. What we have seen is that there is about a 300% increase in audio services, meaning that while we're not being able to provide face-to-face, we're able to provide more audio services right now. There's over 100% increase in what we call telemedicine. And many of you know, in our 254 counties, 70% of them are in rural areas. So that's a unique thing to Texas, right? Even more important that those services are readily available to those individuals. The other thing is that there's a number of new services that have been brought online as a result of the support through our legislative session last session. We have Senate Bill 11 that has now we have more residents that are in, working with the state-funded universities and the local mental health authorities, that we were pretty much able to expand services to children. The importance of having those services available for kids, as well as a resource for our doctors that are seeing children every day that just show up in primary care offices when they need extra help and support. Now they can pick up the phone and call and get some support on someone they may present with mental health challenges. Not everybody has to be seen, with a psychiatrist. Many of our primary care doctors are the first ones to actually come in contact with people. So I think the most important thing is for us to be positioned in Texas and have services that are available to people. I'm also very grateful, because of the support of the legislature, that we have very few people on our waiting list. There's zero wait list for children today, whether that's substance use or mental health treatment through our local mental health authorities and our contracted substance use providers. That's huge. That's major. So that's, those are the kind of things that I think of when I see this.
That's good. Good stuff. I want to just thank.
Can I say something?
Sure. Go ahead, Bonnie.
I would like to make sure that we don't go backwards, and the strides we've made with telemedicine and with telehealth, that we keep doing that after the pandemic's over. So I think we're seeing that it works, and I really would like to make sure that that continues with our legislators, and that we continue to use that telemedicine as a solution for individuals that might not have that accessibility from transportation. With our support groups, I thought our totals would just tank when this started. And now our support groups, we have more people than ever. And I think because we've taken away that barrier of how we get to our appointments and how we get to see someone. So I'd like to see Texas continue to move in that direction, to be an inspiration for the rest of the country of how we do this.
I want to make sure I thank Pfizer again for sponsoring our Texas conversations here so that folks can join us for free. Octavio Martinez has a question that I'll ask you to sort of jump in on, Sonja, which is, how is Texas doing in reference to collecting race and ethnicity and language data to inform policy decisions, particularly, of course, among the non-white community? Do you feel like that we're getting enough data to have the right kind of conversations that are informed with enough cultural awareness? What do you think?
So we do actually have data on, the individuals that we engage with. And to some degree, we can also look at where we see some of the gaps. There's also always an opportunity for improvement there. And I think some of the most recent things that are going on in our nation and the world, give us pause and an opportunity to look at how can we improve, what can we do to do more in regard to focusing on that. And so that's something that we are certainly having greater conversations about at the HHSC level.
Yeah. I want to jump to our next slide, and this is our fifth slide. This is one that gives me hope, and it gives me hope personally because these are three of my lovely kids and my goddaughter who are finding their voice on issues of social justice in this time, and of course they're doing it masked, and at least most of them, and trying to be safe. So as we wind down this conversation and near the end, and of course we've covered some things that give us some pause. Bonnie, let me ask you first: what gives you hope in the world today? What do you hold on to as you're making your way through this time of COVID and our economic recession that keeps you going?
That's a lovely slide, by the way. That makes me happy just seeing that slide. What gives me hope are usually in fleeting moments of quiet reflection. And so when I'm able to see things that don't change, I'll give you the quick example, the tree in my front yard. That tree is 180 years old, and I know that tree stands, and I know that tree will continue to stand. Another thing that gives me hope is the other agencies that are side by side with Mental Health America, Greater Dallas, in this fight to provide resources. And on days when I think we're never going to make any progress, or I know that there's other agencies, there's NAMI out here, there's and I'm going to give Carol Lucky a plug for the work that they do. And for all the other mental health agencies that are out doing the work, that gives me hope. It gives me encouragement every single day.
The tree is still standing. I love that.
Still standing.
Yeah. Sonja, how about you? What gives you hope these days?
What gives me hope is that we have seen so many people and agencies and organizations, people coming together that do have differences, but we've been able to pull together. And our country has a rich history of solving problems. I'm hopeful when I think about all of the frontline workers that continue to get up and go to work every day and meet the demands of in a situation that just looks daunting, but they don't give in and they don't give up. I'm very hopeful that we're going to get on the other side of some of these challenges that we've been talking about today, because we have more in common than we share differences. And I think what I've learned in my career is that when people are focused on solving a problem, that you really do get to a result a whole lot quicker than when you're not all on the same page. So I'm thankful. And I'm also thankful and hopeful, David, because you're having forums like this that kind of educate our Texans and provide information to people. So thank you for creating this forum.
Well, thank you, both of you, Bonnie and Sonja. You've both been engaged with us at our Dallas and at our Austin conferences. I appreciate your engagement, your support of the work we're trying to do. I think you said it well, both of you, but Sonja there at the end, and I'll paraphrase. This isn't quite what you said, but similar, which is we're just stronger together than we are apart. And that's a premise that underscores and empowers what we do here at State Reform. So Sonja Gaines, Deputy Executive Commissioner of IDD and Behavioral Health Services at Texas Health and Human Services, Bonnie Cook, CEO of Mental Health America, the Greater Dallas. Thank you both for being with us. And for the 300 plus folks who were registered to be with us in this conversation, we're going to send you a follow-up email. You'll get this video directly, but you'll also get a survey, which we would love to have you take the time to fill out. We're trying to iterate through this new technology world. We're trying to A/B test to find out what works well and what doesn't work well, and what you're looking for when it comes to virtual conversations. We have our virtual conference. It's typically our North Texas a State of Reform event coming up in September. We'll tell you more about that in the future. But we want to learn from your feedback on these so that we can have those larger conferences be even more powerful and more successful. So thank you all. Appreciate your time, and we'll have more for you at stateofreform.com. Thanks.
Thank you.
Thanks for joining us in this virtual conversation and for your support of our work at State of Reform.